So in this video, we're going to check out Caeserean section on Wikipedia. So Caeserean section, also known as C-section, Caesarean or Caesarean delivery is the surgical procedure by which one or more babies are delivered through an incision in the mother's abdomen. It is often performed because vaginal delivery would put the mother or child at risk of injury or death. Reasons for the operation include, but are not limited to, obstructed labor, twin pregnancy, high blood pressure in the mother, breech birth, shoulder presentation, and problems with the placenta or umbilical cord. A caesarean delivery may be performed based upon the shape of the mother's pelvis or history of a previous C-section. A trial of vaginal birth after C-section may be possible. The World Health Organization recommends that caesarean section be performed only when medically necessary. A C-section typically takes between 45 minutes to an hour to complete. It may be done with a spinal block, where the woman is awake, or under general anesthesia. A urinary catheter is used to drain the bladder, and the skin of the abdomen is then cleaned with an antiseptic. An incision of about 15 centimeters, 5.9 inches, is then typically made through the mother's lower abdomen. The uterus is then opened with a second incision and the baby delivered. The incisions are then stitched closed. A woman can typically begin breastfeeding as soon as she is out of the operating room and awake. Often several days are required in the hospital to recover sufficiently to return home. C-sections result in a small overall increase in poor outcomes in low-risk pregnancies. They also typically take about 6 weeks to heal, longer than vaginal birth. The increased risks include breathing problems in the baby and amniotic fluid embolism and postpartum bleeding in the mother. Established guidelines recommend that caesarean sections not be used before 39 weeks of pregnancy without a medical reason. The method of delivery does not appear to affect subsequent sexual function. In 2012, about 23 million C-sections were done globally. The international healthcare community has previously considered the rate of 10% and 15% ideal for caesarean sections. Some evidence finds that a higher rate of 19% may result in better outcomes. More than 45 countries globally have C-section rates less than 7.5%, while more than 50 have rates greater than 27%. Efforts are being made to both improve access to and reduce the use of C-section. In the United States, as of 2017, about 32% of deliveries are by C-section. The surgery has been performed at least as far back as 715 BC, following the death of the mother, with the baby occasionally surviving. A popular idea is that the Roman statesman Julius Caesar was born via caesarean section and is the namesake of the procedure, but if this is the true etymology, it is probably based on a misconception. Until the modern era, C-sections seem to have been invariably fatal to the mother, and Caesar's mother Aurelia not only survived his son's birth, but lived for nearly 50 years afterward. There are many ancient and medieval legends, oral histories, and historical records of laws about C-sections around the world, especially in Europe, the Middle East, and Asia. The first recorded successful C-section, where both the mother and the infant survived, was allegedly performed on a woman in Switzerland in 1500 by her husband, Jacob Neuffer, though this was not recorded until 8 decades later. With the introduction of antiseptics and anesthetics in the 19th century, the survival of both the mother and the baby, and thus the procedure, became significantly more common. So these are some uses, medical uses, prevention risks, mother, subsequent pregnancies, adhesions, child classification by urgency, by characteristics of the mother, Caesarean delivery on maternal request, after previous Caesarean twins, breech birth, resuscitative hysterotomy, other ways, including the surgery technique, anesthesia, prevention of complications, skin-to-skin contact, recovery, frequency, Europe, United States, China, history. Caesarius of Terracina invoked for the success of Caesarean delivery. The church of San Cesareo in Palatio in Rome bears his name. He is venerated as a saint in the Eastern Orthodox Church and Roman Catholic Church, with a feast day on 1st November. The origin of the term is not definitely Roman lex regia. Spelling, court cases, presence of father, special cases. So I will add to the title, so women or like people carrying babies for the first time know that it's important. So we'll write Caesarean delivery on maternal request. Thanks for tuning in and see you next time.